parents, we've got some tips that will certainly make you smile. For Children's Dental Health Awareness Month, we talked to Dr. Anthony LaVacca for some advice on how to take care of your child's oral hygiene.
Several of the do-it-yourself at-home tips for taking care of your child's teeth are: one, which is very important, is not to allow them to drink Coca-Cola or any very sugary drinks. And if they do drink it, make sure we're taking care and brushing their teeth at night and in the morning before they go to bed, so we don't let that sugar substance sit on their teeth, which is the primary cause of tooth decay once the bacteria starts eating the sugar. Second, which is very important, is to also provide your child with a mechanical toothbrush. You can buy them in any CVS or Walgreens, and they can be a Disney character one. It's got a little battery in it, it rotates back and forth, and it really helps debride the tooth of any plaque that's built up on the tooth. As they get older, you could also purchase one of them that is very similar to this, which is an Oral-B toothbrush, which works out fantastic. So as a dentist, a typical conversation that does come up at typical dinners is, what type of toothpaste do you use? What type of toothpaste should my child use? Well, with children, we'd like for you to utilize a fluoride toothpaste. That'll help remineralize any tooth at home and make sure the child spits the toothpaste out and doesn't swallow it. One of the things we advocate here is there's a Crest toothpaste for children. Some of it has a little different flavor and a different feel, but we utilize the Crest toothpaste here, and that's what we give our patients to take home for their routine hygiene at home. Making toothbrushing fun at home is a challenge for the parents and a challenge for us. But you can do that by utilizing some of the characters that are on toothbrushes nowadays, such as Ninja Turtles, Elsa. They have all these character toothbrushes, and we can bring the child that toothbrush and say, hey, look, Elsa wants to take care of your teeth tonight. Or we can call plaque and bacteria the tooth bugs, or the tooth bugs that eat it. When they come here for their exam, we typically will show children things that we're going to be using during the exam on a larger scale so they can hold and feel it and become part of the dental experience to give them that positive dental experience. In utilizing digital x-rays is the safest way to provide your child with x-rays that are completely diagnostic and allow for us to find cavities which are in between the tooth or on top of the tooth. As the child becomes 5 years of age, it is very important to get their first molars sealed. Sealant is a light resin that goes over the top of the tooth and blocks out all the little grooves in it, so it doesn't allow for the plaque and bacteria to get stuck in there. One of the things we like to do, even with the baby teeth and the adult teeth, is to apply topical fluoride at every time they come in to get their teeth cleaned. Topical fluoride allows for the tooth, if there are some areas of demineralization, to remineralize with a harder substance that'll prevent the cavity from getting in. So a simple topical fluoride placement can help your child to prevent some tooth decay in the future. Let's talk a little bit about space maintenance for your child's teeth. It is very important nowadays to, as your child's teeth are, the permanent teeth are erupting and the baby teeth are falling out, to make sure that their jaw has enough room for the adult teeth to come in without causing a lot of crowding. So we highly recommend having your child be evaluated from an orthodontist at the age of 5 to 6. This is critical because an orthodontist will evaluate if the patient's jaw has enough room for all their teeth to come in. So that was a few steps for you to take care of your child's teeth and give them optimal dental health. Now back to you, Lisa.